So our first question here is about a 32-year-old woman who's coming into the emergency department due to shortness of breath. And I might bold at least the chief complaint that we have here, which is shortness of breath. She reports progressively worsening dyspnea on exertion over the past 4 months. I might also bold that, or at the very least, I would bold the duration of symptoms. So we have shortness of breath and we have past 4 months. I'll point out too that as we get really good at this stuff, we might recognize that dyspnea on exertion predominantly means chronic lung disease or chronic heart disease. I'm probably looking at somebody with COPD or restrictive lung disease or congestive heart failure of some type. Could it be something else? Sure, but we're developing that narrative. We're going line by line, and right now that's my supposition, so that's what I'm going to work with. They tell us she can no longer climb 2 flights of stairs to her apartment without stopping to rest frequently. She has no other significant medical history. She does not use alcohol, tobacco, or illicit drugs, and her family history is significant for an aunt with a quote-unquote lung problem. Now, you might look at this and say, irrelevant. How could I possibly utilize this piece of information? They're literally not telling me anything. However, it would be important to say that if this does seem suspicious, like quote-unquote lung problem, okay, that could be anything in the world. Maybe we don't need to diagnose this yet, but we need to keep in mind that there's a possibility that this person's shortness of breath has a genetic component. And that changes what kind of diagnoses make the most sense for this person, especially because this is a 32-year-old woman we're looking at. Her temperature is 98 Fahrenheit, her blood pressure is 140 over 82, and her pulse is 75. I might bold these just out of good habit, or highlight these just out of habit to make sure that we have the vital signs easily visible for ourselves as we're looking at this question. In particular, though, it probably would be useful to highlight the hypertension that we're seeing in this person. This is definitely higher than 120 over 80 as you'd expect in a healthy 32-year-old woman. Right now, her pulse is 75, respirations are 24, and her BMI is 19. That's a low BMI. 20 is the lower limit of normal typically. Now, that doesn't mean she's anorexic. That's 18.5 for the cutoff there, but I bolded it or highlighted anyway. Cardiac, pulmonary, and abdominal exams are all within normal limits. ECG shows right axis deviation. A chest x-ray shows prominent pulmonary arteries and enlarged right heart border. And they want to know which of the following is the most likely mechanism of her underlying disease. You notice I didn't read the question first in this case. Personally, I'm agnostic on that. Kaylee seems to favor it quite a bit. I'm going to say the other end of things. It's up to you. It depends on what you like. If you find that reading the question first, reading the answers first is only impeding you, then don't do it. If you find it works for you, as it does for a lot of students, then definitely stick with it. I'll point out that we should probably highlight the pathological findings that we have here, which include the right axis deviation and the prominent pulmonary arteries that we're seeing here. So if we highlight the things that we said we would, we've got shortness of breath for 4 months and these findings that we're looking at, an X-ray and EKG. The next thing we would want to do is look through the answer choices and start kind of discerning what they mean and which ones we can probably eliminate. So as I make my way down our list here, diastolic heart failure leading to pulmonary venous congestion. Well, pulmonary venous congestion implies to me that I've got a left-sided heart failure. The pulmonary veins are going to the left atrium. But they're telling me that I've got right axis deviation in this case and an enlarged right heart border. If one of the sides of the heart is busted here, I'm thinking it's the right side. So this might be something that I would eliminate out of hand. Furthermore, if we move down to choice C, a multi-system non-casein granulomatous disorder, this is the code for sarcoidosis. We can see that they're talking about sarcoidosis because that's what non-casein granulomas are. That doesn't quite make sense with the cardiac findings that we're seeing here. Maybe if we saw an X-ray that had granulomas or like some kind of interstitial inflammation, perhaps, or hilar lymphadenopathy, but enlarged right heart border is not hilar lymphadenopathy. So I'm eliminating these two answer choices because they don't really make any sense to me. Now, I would have highlighted this before, but we should probably emphasize the low BMI that this patient has in this case, which means that I'm probably not looking at a person who has obstructive sleep apnea. As we move down to answer choice E, recurrent airway collapse during sleep causing hypoxemia is the code for obstructive sleep apnea. So nope, definitely not with a 19 BMI patient. So kind of going backwards again, the thing that I probably would have highlighted in the first place, the weird genetic component, the aunt with a lung problem, this tells me that I'm probably looking at some kind of like congenital disorder that's only manifesting now in early middle age. Describe my own age here, so sorry about that to everybody who's 30. So as far as the answer choices go, the only one that really makes sense for a like genetic issue between the two that we have remaining at this point would probably be this kind of like primary pulmonary hypertension type picture that we're seeing here with the BMPR2 mutation. Now, maybe I don't know that that's what I'm looking at in terms of this answer choice. Maybe this answer choice is opaque to me. Nonetheless, mutation, genetic issue, this is a family issue that her aunt also had, and furthermore, relatively young individual we're looking at with this disease. So to kind of like break this down top to bottom in terms of how I approach this, I developed a narrative as I was going through, and I highlighted the things that I thought were important, specifically focusing on the fact that we had a chronic lung disease that looked like it had a genetic component in this case. In addition to that, I started utilizing the actual highlights that I did, the important disease processes that we're seeing here, to start ruling out answer choices. And the way that we did that is we recognized that this was technically a two-step question in the sense that we had to diagnose this patient, but we also had to decode each answer choice. Each answer choice didn't say primary pulmonary hypertension or obstructive sleep apnea. They gave you language that you had to decode and understand in order to figure out what these are. It might even be useful, especially as you're starting out, but maybe even on the real exam, to have a scratch paper available to yourself so you can literally write down like, A is left-sided heart failure, E is obstructive sleep apnea, C is sarcoidosis, so that you can help yourself to identify the second step of this, which was using the buzzwords that they gave us in the answers to determine what diseases they were actually discussing. And finally, when we got towards the end here, we were down to a 50-50. You're going to find, especially in the middle of your studying, that this is going to happen a lot. You're going to miss a lot of questions this way. It hurts, but this is definitely the best way to miss a question is by guessing wrong or selecting the wrong 50-50 choice, as opposed to just randomly choosing without anything struck out. So do your best to narrow down the field by crossing out answer choices that simply don't make sense. All right, so that was our first question there. Kaylee, anything to add before we move on to question number 2?
No, I think one of the things you pointed out at the end is that, when you're thinking about how they're going to test, 2 years of material with 400-ish questions, this is the way they do it. They make every answer choice a, high yield topic. So when you're studying and doing these year world questions, it's these patterns and these descriptions that you really want to start to pick up on, because this is how, for example, they're going to test, left-sided, congestive heart failure. This is choice E is how they're going to, test obstructive sleep apnea. So these patterns are what you want to start to recognize, because as you do more year world questions, you're going to start to see that they pop up as you go. So also focusing on learning one thing per question. Obviously, you want to read through the answer choices and make sure you understand why one was correct over another, but realizing that these are all high yield topics: sarcoid, obstructive sleep apnea, congestive heart failure, they will all come up again. So focusing on one thing at a time too with every question when there's so much information to learn, realize these will come up again. They're all high yield topics, and this happens really frequently in UWorld.
Absolutely.